I'm a general surgeon, so this research actually about a little bit how clinician interprets tumor microenvironment studies in the clinical practice and how we improve it and how can we talk between the preclinical studies and implement it the clinical way. This is the reason I would like to show that tumor microenvironment is very important for the future personalized treatment option. And in this way, I would like to show how neoadjuvant treatments changing tumor microenvironment, and in this study, I specifically focus on the macrophage. We already know that tumor microenvironment is a complex network, and especially tumor-infiltrating lymphocytes are playing important role for the tumor development, tumor regression, and also chemotherapy response and resistance mechanism. But tumor microenvironment, we already say that it's a complex network, and they are interacting with also macrophages, dendritic cell, and also natural killer cell. In this study, I would like to show that the second most important component as a macrophage, how working in the tumor microenvironment. And my study showed that actually they are also playing role for the chemotherapy resistance mechanism. In this study, we show that tumor macrophages decrease after the neoadjuvant chemotherapy, and if there is a more tumor-infiltrating macrophages after the neoadjuvant chemotherapy, it's related to chemotherapy resistance mechanism. For showing the tumor-infiltrating macrophages, we use the immunochemical analysis, and we choose the two markers. One is CD68, is a pan-macrophage marker. The other one is CD163, is well known as a M2 macrophage marker, which is related to with more oncogenic and immunosuppressive macrophage marker. And we analyze both different markers and trying to show which one is more affecting and is there a difference between these markers. And at this moment, it's difficult to say how can we use this result in our clinical analysis. Of course, we need further studies to understand better, and we begin to use this in our clinical practice. But I assume that it's going to be in the true comms for us.